there are also some myths, right? There are at least a dozen double-blind studies that have found that sugar does not cause hyperactivity. Not true. However, eating simple sugars too much can cause these really fast blood sugar swings. Because when you eat something like candy, I have a candy here. This, you can get a little burst right before a test, right? So right before a test, drink some water, okay? Have a candy. I'm having a ginger candy. Ginger is good for nausea, which I have a little bit of right now. And for a couple of, other things. We'll talk about ginger one day. Not today. So we're getting a little candy. You can kind of increase that. What a pretty wrapper, right? I know. I'm so excited. The simple sugars in that candy will break down during the time you're taking your test. You get that boost, but then it'll be gone. It's not good for lasting long-term glucose up in your brain. And when you get that sugar down, it's like withdrawal. You get irritable. Brain function doesn't work as well. So you need something that's a complex sugar that's consistently working in your brain all day long, right? That's why eating high value meals during the day, right, are going to be more helpful to you than snacking on sugars, so forth. So try to get complex carbohydrates. And they are literally complex. That's distracting me also. Thank you for pointing that out. I'm not sure that that's going to stay up very long. That painting from an artist who happens to be deaf here in Pyeongtaek, South Korea. And my theory, I'm now sitting on all these oranges. My theory is that his colors are so much brighter and more beautiful because he has other senses compensating for the lack of the one sense. That is my medical theory about why I freaking love this painting. It's an oil painting. It's gorgeous. Okay. Back to you. Sugars. Complex carbohydrates literally means that the molecule in the carbohydrate is more complex. It's got all these different branches versus a simple sugar that might just be like one little molecule, really easy to break down. Okay. Furthermore, many sweet processed foods also contain artificial colorings. Now, there is evidence, and I can link the studies below. There's so much debate about these artificial colorings, right? A lot of physicians will tell you it does nothing. You have to evaluate it for yourself. Anything I tell you, I'm always going to tell you, look at the evidence, figure it out. Because a lot of times there's evidence from multiple perspectives because the world is more complicated than the simple pictures of the broad brush we try to paint it in, right? So, the things that have been found to worsen hyperactivity for many people. Petroleum-based FD&C and DNC colors, artificial flavors, BHA, BHT, DBHQ. Again, we can't paint these with a broad brush either, right? We can say, oh, all artificial things are bad for us. Most of the medications I give out are also artificial, and some of them save people's lives. So, the artificial sweeteners aspartame, now called Truvia, neotame, and allatame. Not all artificial sweeteners. I haven't read anything about sucralose being harmful for somebody with ADHD. But again, that may change. The Center for Science in the Public Interest has actually even called for the FDA to ban certain colors, specifically blues 1 and 2, green 3, and this is where I have to consult my list because I can't remember these colors. Write them down. Again, put it in your notebook so that when you're shopping, you can look in your notebook. Oh, these are the things I'm not supposed to have. In fact, I have them in it. Use these. Isn't this lovely? This is a weatherproof notebook. Oh, actually, you can't use it. I've already written in it. But you write down little thingies. Okay. This is weatherproof too. It's neat weatherproof paper. If it rains on it, it won't melt. Army stuff. Write it down in your little notebook. Okay. And the things you will write down so that you can compare to the back of your food that you purchase are going to be blues 1 and 2, green 3, orange 8, reds 3 and 40, okay? And yellows 5 and 6. Right. The diet that restricts these things that I just mentioned is called the Finelli diet. There are studies of children who received the Finelli diet, and 73% had improved behavior. There was a study involving more than 1,800 children that showed significant improvement in hyperactive behavior on a diet free of benzoate preservatives and artificial colors and flavors. And yes, I absolutely always consult the literature, right? Don't trust a physician who does not consult the literature, who doesn't update, who doesn't learn new things, because we are learning new things about medicine all the time. And if we don't consult the literature, we as a community are failing our patients, and sometimes we don't have time, right? Sometimes we don't have time to be consulting the literature. That's the unfortunate truth. There are ways to help your physician get more time to spend on you. We'll talk about that in another visit, where we will plot to take down the medical establishment so that physicians and patients can work better together. We'll do that. I have so many exciting things planned for us. Okay. Sometimes it might be overwhelming. Is this overwhelming? I'm glad you're so excited. You're so motivated, and good. Being motivated about your health is not a bad thing, because it helps you to perform better, to help others. The better you can perform, the better your community works as a whole. So, I'm not a big fan of selfishness. I'm not a big fan of taking care of yourself just for yourself. You are welcome to disagree with that. It's a philosophical thing. But I'm a really big fan of taking care of yourself so you can help everybody else. And you can't help anyone if you don't take care of yourself. If you don't take care of yourself, you are harming a precious resource that was put here on the planet. You are a precious resource, an asset to the species, with or without ADHD. In fact, it may be that the reason that you have the brain you have is because for the purpose that you've been put here, that is the brain that is necessary. So don't be down on yourself. Find a way to use your powers rather than disliking them. That's what we're here about. Roger that. Okay. Caffeine. Let's talk about caffeine. Don't worry, I'm not here to take away your precious coffees. I will take away your precious sodas, though. Give them to me. Get rid of them. Caffeine actually improves attention better than placebos, not as good as prescription medications. I know I keep getting on that. I'm definitely not trying to push you to take medication. I just want you to have the facts. Some families even use caffeine as a supplement to their stimulant medications. Green tea contains caffeine and also some of these amino acids that you need for that kind of long-term performance. And you also, specifically theanine is in green tea, which counteracts that jitteriness you might get from coffee and that kind of hyperactivity. Because some people have the attention deficit kind of ADHD, and some have the more hyperactive kind, right? Get that feeling of calm. Obviously, side effects: insomnia, jitteriness, palpitations, blah, 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 you can get from caffeine. It can be addictive. Withdrawal symptoms can occur with as little as 1 to 2 cups daily. Caffeine is a real drug. People don't realize this. It is a drug, and you can be addicted to it. It's interesting, by the way, that our society is okay with addictions to some drugs, but not others. I won't go into that further. We will not open that can of worms. I said it's interesting. I did not say I agreed or disagreed. We're not making any political statements here. Caffeine is not a good substitute for getting a good night's sleep. Okay, that is straight from Dr. Rakel is not wrong about that. Food sensitivity is 6 to 10% of children actually have allergies or sensitivity to food. You may too. Do you need to be tested? No. Allergy tests may be negative even if a food is problematic to you because you may not be allergic to it. You may just be sensitive to it, which is a different thing. So getting allergy testing might be totally useless to you. What you need to do, basically there's no substitute to listening to your body. Try restricting down, limit your diet, try having chicken and spinach and then add things in and see what kinds of things affect you, right? What kinds of things make you not feel good. So if you suspect a sensitivity, I'd recommend taking a food diary. And on your food diary, you're going to write down several categories. One, how I felt today, how I behaved today, what I ate today. And in that how I felt, it needs to be both physically and emotionally. Did I have rumbly tumbly today? How many times did I go to the bathroom? That's important. You need to pay attention to your poop. Okay? So, some studies have found that oligoantigenic diets, which are diets for people who have allergies, helped with ADHD as well. So basically an elimination diet, you go all the way back to foods that are known not to cause a lot of problems, and then for at least 2 weeks, and then you slowly reintroduce other foods, every 3 to 4 days. However, I would recommend we do a nutritional visit. Yeah, because I don't want you to suddenly have a nutrient deficiency because we're not doing this properly, and then you are not eating anything at all, and then ADHD gets worse. So I would not recommend doing that without the supervision of a physician. We can talk about nutrition. Your non-secret doctor can talk about those things with you. Something else to consider, again, very highly debated. There is not, evidence for organic foods, highly debated. There is not solid, evidence to where your physician can be 100% you should only eat organic. I'd like to say that I may be like everybody else, but be careful what you believe because there's also money on all sides of the equation, right? There's money in the big farm companies that don't want you eating organic, and there is money in the other companies that do, right? So always follow the money. Where does the evidence lead? I'm glad you asked. So, there was a study. Children who eat organic produce have lower levels of toxic pesticide chemicals in their blood than children who eat non-organic. Does that affect attention? Not enough. We don't have a lot of studies on that yet. Okay. So mineral levels in food that have been tested since about between 1940 and 1991 have fallen about 76%, according to one study. I will try to link these studies below, right? Organic crops tend to have more minerals in them. We talked about these minerals are good for your body, good for your attention. I don't have any study or something that says that non-organic food is going to affect your ADHD. This is the information that I have. This is the only studies I have. You can get more omega-3 fatty acids from cows that have been eating those omega-3 fatty acids, right? So that in that way, I can tell you for sure that organic foods are a little better. But otherwise, I actually can't tell you very much specifically about organic and ADHD. And everyone's different. You may have that experience where that food was better for you. But it's important also to consider your stress level, right? I don't want you to get so stressed out every time you go to the organic food and then feel guilty because you can't find it and you can't eat organic and blah, blah, blah. And you get discouraged. With all of these things, I don't want you to feel guilty. I want you to try to incorporate it one at a time, little at a time, because you can be overwhelming, right? You do the best you can for you. Okay? So, try it, don't try it. Look into it, okay? I wouldn't spend too much time on it. I would focus more on the things we have evidence for, because you can make a lot of these changes we have evidence for, right? The exercise, we have evidence for that. The omega-3s, we have evidence for that. Those are changes we can make. The other changes with less evidence, look at them down the line. And if you want to look into it, do it. Yeah, absolutely. I'm definitely not downing. My goal is to grow all of my own food. But I also can't tell you that to do differently than me is wrong, right? And the reason I can't tell you is because I don't have evidence for it. Yeah, I personally think organic is better for you. There is not evidence, again, that will affect your ADHD. You kind of see where I'm going? Like, I cannot let, and this is a problem that a lot of us have as physicians, we let our own beliefs and preferences get in the way of the treatment of the patient, right? We do it without noticing it. I don't want to do that to you, so. And make sure, when you're looking into stuff, you don't let your own beliefs and preferences, and that's hard, right? How do we not let our own preferences get in the way of our own care? Absolutely. All right. So we talked about diet. Let's talk about stress regulation. Sure. I don't think that pulse is a particularly good way to measure stress levels. It can be. When you're stressed, your pulse will go up. Yes. That's a good question. There's a couple common sense stress management strategies. One of them is gratitude. Get in the habit of listing 3 things you're grateful for before bed. I know, I need to do this and I have trouble doing it. Counting, count to 10 before reacting. Very stupid, but common sense strategy. Know your own early warning signs for stress. Are you clenching your jaw? Is your face getting red? Are you feeling hot? I know I start feeling jittery and hot, and then my mouth starts to run very, very quickly, and I don't have control over it. That's a stress sign. Clenched hands. Know yourself. Plan activities based on whether you're a morning person, a night owl, an auditory visual learner. Know those things. Oh yeah, we can talk about that kind of testing. Absolutely. That's another visit though. This one's already longer than I intended. Not because I don't have time for you, but because you also have other things to do in your life. Rehearse. Anticipate difficult situations. Role play them in your head. Visualize them. This is not the same as obsessing over them. Don't sit there and think the same thing over and over again and come up with the same bad scenario. Don't do that, please. Okay. Think positively. Think, okay, this is what I'll do if this comes up. And this is an image of me winning. This, think good thoughts. Plan ahead. Other things that can help stress, moving meditations like yoga, qigong, tai chi, blah, blah, or sitting meditation, whether that's religious meditation. I like to meditate on different Torah principles, the Tehillim or Psalms and other things like that. You might find other things more helpful. It's religious meditation. It's an option. That's different than concentration meditation, stillness meditation, other sitting meditation types. There's a lot of things. These things have been found to be helpful for stress. A lot of evidence for that. Okay. I think we might have hit on almost everything. Oh, what's the evidence? Oh, yeah. More focused EEG patterns. Regular meditation practice actually changes your cortical blood flow. It increases blood flow in the areas that deal with attention, focus, planning, emotional self-regulation, mood. Well, you're going to have a whole bibliography below. Yeah, we can do a visit about meditation, different kinds of meditation, what will work best for you. For now, let's just get the broad strokes down. I don't make a lot of painting metaphors. I really like this painting. And then we'll get the more details in later. Be careful when looking for meditation advice, recommendations for health, because there is no formal certification for health meditation, right? National certification for body training. Always ask your provider what their experience is, what they've done before. An honest provider should be comfortable telling you. Yep. For young children, 10 minutes of meditation twice daily. School-age children or you, 40 to 60 minutes a day. That's so much, I know. But that can include something like yoga, tai chi. That can be part of your exercise time too. Exactly. So, biofeedback is another option. I would love to get you into some biofeedback. There are different EEG frequencies that correspond with alertness and processing. The beta wave above 14 hertz is active processing. The alpha wave between 8 and 13 hertz is, active alert. The theta wave from 4 to 7, transitional state. That's when you're in imagery, relaxation, meditation, those kind of associations. Okay. Biofeedback is a way where we measure the EEG patterns while we try to help you to control them. Better get which waves you need, right? Insurance will usually pay for EEG biofeedback. That's done by a professional psychologist, so I can refer you to that. Yeah, no, I don't do that. I wish I did. One day I will. Oh, yeah, absolutely. It's actually as effective as many other standard therapies, like integrative or CBT, other behavioral strategies for ADHD. They found that it could improve your IQ, behavior, other kind of things, and scores-wise. Well, we should have a debate about the value of the IQ score at some point because it is not universally useful. But anyway, it is a way to measure, and it got better with these. Even with people who are suffering intellectual disability, what used to be called mental retardation, or were on the autism spectrum, but also had ADHD, even those patients found help with the EEG biofeedback. Absolutely. I can get you referred. That's a lie. I cannot get you referred. I'm your secret doctor. Only a real doctor can get you a referral. Ask them about it, okay? Okay. I know. This is very scandalous, having a secret doctor. I'm your secret pocket doctor. So, large studies suggest that at least in the short term, most effective therapy for ADHD is both medication and some kind of counseling, cognitive therapy. Cognitive behavioral therapy, CBT. Ask your physician about someone who can do that. Okay. Negative self-labels from your behavior cause you to blame yourself. It can cause oppositional behavior, and you can get other social problems because of how frustrated you feel about your own performance with ADHD. Yeah, absolutely. Professional counseling, metacognitive therapy. Let's see what else. Ask about getting special psychological testing. I'm actually in line for my special psychological testing now, because sometimes you can find about not physically now I am with you, but you can sometimes find other things that contribute to your difficulties. You might have a learning disability you don't know about. You might be a little bit on the spectrum. And helping identify those things and finding the appropriate treatment for those things can help with your concentration as well. In our patients who are above 65, concentration deficits actually usually indicate or can indicate depression. Well, that's why we did that whole diagnosis visit already, where we went through all the different possibilities of what you have, yeah. No, that's not the same as psychological testing. That's diagnosis for some things. There's an additional level of testing that has to be done for certain conditions. Absolutely. Social relationships. Get you in a support group. We can think about it. Yeah, absolutely. ACOM, All Kinds of Minds, nonprofit organization. I love that title too, All Kinds of Minds. There are all kinds of minds, right? Children and adults with attention deficit hyperactivity disorder, CHAD. I know there's a lot of information. You can see why I have it in front of me as well, instead of just trying to, because it's a lot. Again, you write it down. That's CHAD with another D at the end, CHADD. The National Federation of Families of Children's Mental Health, parent-run organization, kind of support family. Learning Disabilities Association of America, founded in 1963. They've also got state chapters. And the Mental Health America, formerly known as the National Mental Health Association. They're the oldest community-based network that we're talking about here. They kind of do a lot of advocacy. They helped with the Mental Health Parity Law, 2010. They do a lot of advocacy. If there is a problem for your family member, your child, your sister, there is a 1999 addendum to the U.S. Individuals with Disability Education Act, that's the IDEA Act, found that, saying that with any kind of disability or needing special support, I don't like to think of ADHD as a disability. You can still work, you just need adjustments. And it's adjustments to work in this society. You might do very well in a different one, right? So, but anyway, having any kind of disability, neuroatypical, those children and youth need to get special services or accommodations that address their problem and help end its effects. So that's called FPB, the FAP, the free appropriate. I talked to a lawyer about this. Basically, the rule is it has to be free, it has to be appropriate. It has to be appropriate to the issue. If it is not appropriate to the issue and not evidence-based, for example, if your child with autism isn't getting ABA, then you need to fight about that. You have to be getting what you need to get, because otherwise that money's going to pencils and sports teams. I know, so political. Oh, gasp. Right. Section 504 of the U.S. Vocational Rehabilitation Act prohibits discrimination against any person with disability. And under that section, you may get special services like a smaller class size, tutoring, modification of homework assignments, etc., etc. Obviously within reason, right? There can be a tendency when you over-advocate, where you victimize yourself a lot. You're always fighting to talk about your issues so much that you identify very strongly with them and never think positively about driving forward, right? I don't want you to do that. I don't want you to overemphasize, associate with those things, but you have to stand up for yourself. Within reason, which is why it's good. And I don't mean to say that you shouldn't stand up for yourself. That's not what I'm trying to say. I'm trying to say be careful about victimizing yourself. Be careful about always saying, I can't do this without help. I need help. I need help. I need help. Because it can make you actually not get better. Because it's all about that mentality, right? Having those positive mental associations. On the other hand, you have to have a realistic positive mentality. If you need help, you need help, right? If you need that smaller class size, you ask for it. You gotta get what you need to get. If you haven't gotten sufficient services for your child within 6 months, I'm gonna have to take that out. Within 6 months of, I'm like Pickle Rick over here. Within 6 months of asking the teacher or principal, If you have not gotten sufficient help within 6 months of asking the teacher or principal, write to the district and keep moving up. Talk to attorneys. It's in the law. And you may need a specific evaluation for learning disabilities. You can get IEP in place. That is a individualized education program. Yep. Let's see. Environment. I've talked a lot about how the social environment around you can affect ADHD, right? Let's talk about, just for a second, think about things like smoking, alcohol, illicit drugs. Adults who are using those as primary stress management strategies that, since they're unhealthy stress management strategies, they don't work long term. If you're around that kind of environment, that also can harm you, right? So trying to get a positive environment. Having music in your area, like good music around you, getting that environment for your brain, using it as a learning strategy, like songs with rhymes help you memorize things, right? Calendars, schedules, how can you modify your environment to support you? And that's what a lot of this conversation's been about, right? Additional therapies. There are botanical options. Melatonin does not improve daytime symptoms of ADHD. They've studied that, but it does help your sleep. Especially in day shift workers or people with delayed sleep phase syndrome. Again, we'll do a whole visit about sleep at some point. One study of children with ADHD found that 4 years later, more than 2/3 of those children still continued taking the melatonin they'd started 4 years before, because they found it helpful and there were no side effects. So it's useful. It can have side effects. They had no side effects. Yeah, we can go back to environment again. That's not a problem. Hey, I jump around, you can jump around. Yeah, I'll give you a couple more. Spend more time in nature. Be mindful about how you use music to calm, focus, and re-energize you. Schedules, proper safety equipment, clocks, calendars, lists. Don't spend more than 2 hours in front of electronic devices daily. That is impossible for some of us, right? Some of us, that is our job. Like, I probably spend most of my day in front of an electronic device because of how integrated that electronic device is now into patient care. I'm in front of an electronic device right now. Get yourself breaks as you can, right? Stand up, stretch. I'm going to take